Hello, everybody. I'm Dr. Gabriel Siquier, and today we are going to present CELL latest technology, CELLBOOSTER, that we've created with a patented check technology. And I see that some participants, they are joining now. So we're going to wait for a few minutes to let everyone to connect. And don't worry if you arrive a little bit late, because this webinar is completely recorded. So you will get a link so you can get back to it very easily. Just for the newers in the group, if you have any question during the webinar, feel free write it on the answers, and then at the end we will have time to discuss all of them, but I will not stop during the presentation. So let's gonna wait for 2 or 3 minutes, and then we are gonna start. And today we're gonna present CELLBOOSTER shape, face, and body approach. I'm Dr. Gabriel Siquier. I'm the founder and medical director of Demeter Clinics International. We have clinics in the Netherlands and Spain. I have been collaborating with the pharmaceutical CELL for many years, and I became one of the KOLs and ambassadors. And to university level, I'm part of the research group NEOMA at the University of Girona in Spain. So I was telling you, we are going to talk about CELLBOOSTER shape, face, and body approach. If you have any question, feel free to make it on the question and answer section. And at the end of the presentation, we will take time to answer all of them. Okay, so today I'm going to present the check technology and CELLBOOSTER. It's a new era on injectable boosters because we're having an effective delivery and long-lasting results. And all of that is based on the patented check technology of CELL. So maybe let's gonna take a little video about that while the people is connecting. So we could see that the check technology is formed by shared formation and simultaneous pressure in 3 steps. What is the uniqueness of this technology? So we have 3 very important advantages. So we don't have any chemical binding agent. So it has been everything through a mechanical process that will allow us, after this matrix creation with the active ingredients that we have into the formulation, to have a slow release of the active ingredients, but also simultaneous release. So we will not have competition for same receptors. And each CELLBOOSTER formulation has active ingredients that have been selected to cover multiple indications. So we can combine them for different issues on the same session. We will see that combination protocols a little bit later. What is the difference with other products that we have in the market? What is the positioning of CELLBOOSTER? So we can have mesotherapy products that they can be made with native HA or active ingredients, a cocktail. with vitamins or amino acids, but the short life of this hyaluronic acid, of these products into the tissue, will force us to have a complete protocol. We need to repeat 6 or 8 times the procedure, and we need to do it weekly. If we cross-link these products to make them stay a little bit longer into the tissue, then we're going to have hyaluronic acid stabilized, well known as fillers, but the indication will not be the skin rejuvenation, but filling and volumizing the tissues. And then we have Cell Booster. Cell Booster is an injectable stabilized booster, CE marked, and it's a complex with hyaluronic acid, vitamins, and amino acids without any chemical binding agent, thanks to the patented check technology. What makes that? What means that? That means that the structure of the molecules has been respected, so we will maintain the biological activity of the components, and we will be able to deliver more effectively to have a better and a faster aesthetic result. Cell Booster is the new generation of skin boosters, and there are things that they are very important to mark. First of all, it's a medical device class 3. Medical device class 3 means that you can inject it. We have gone through all the regulations and all the safety tests to inject this product in the skin. It's CE mark, so that means that it's safe and effective. Swiss made. Swisscell is a pharmaceutical that is located in Yverdon-les-Bains in Switzerland, and is not only free HA, is stabilized injectable booster complex. So we're going to have different amino acids, different vitamins to target specific indications. Another thing, that this technology is patented by Swisscell. So we don't have any other competitor in the market that with the same technology. So it's the first CE mark injectable stable booster. And here I show you the certificates of the CE mark and the patent, and also of the quality. We have 4 products in the range: lift, glow, hair, and shape. Today we are going to focus on shape, but we have different indications, like can be for lifting in an older demographic, 40 plus. We could use Cell Booster Lift. Cell Booster Glow, very good indication for pigmentation. Cell Booster Hair, very good indication for alopecia, hair loss, or thinning of the hair. But the focus of today is going to be Cell Booster Shape. It's for local fat and double chin, for liquid retention, and also to help lymphatic drainage. Which ones are the targets of Cell Booster? So we try to reduce the cellular damage. We try to reduce also the inflammatory response, trying to minimize the damage to the skin cells and to the reactive oxygen species. Which one can create the cellular damage? That is going to alterate and destroy the hyaluronic acid, but also is going to affect the senescence of the cell, of the skin tissue. It's going to be the aging of the skin, of course, the UV light, the smoke chemicals heat, but also cellular stress. The cells Cell Booster is going to target, they are going to be the fibroblast on the dermis, keratinocytes on the epidermis, and then of course some specific cells like melanocyte for hyperpigmentation, or adipocyte if we want to reduce localized fat. Remember that hyaluronic acid is the main component of the extracellular matrix and will target these cells to produce more collagen, elastin, and hyaluronic acid, but will also induce, thanks to the antioxidant effect of the active components that we have into the formulation, to cell regeneration. So we're going to have cell growth and cellular regeneration, so you're going to have a more healthy, more compact, more rejuvenated tissue. Cell Booster Shape is also made, of course, with the check technology, and has the presentation in a 3 milliliter vial and with 18 milligrams of hyaluronic acid. The package is coming in a box of 6 vials, and the main indications are fat reduction, water retention, help a lot for lymph drainage, and localized fat is going to be the key point if we are talking about the face, the double chin, or some specific areas that can also be targeted on the body, but also lymphatic drainage, like can be the cellulitis that we are going to see today. So summarizing, the indications will be local fat accumulation, sagging skin, double chin, fat cheeks, edema, periocular edema, cellulite, water retention, and puffiness. Which ones are the ingredients into the formulation? So of course, hyaluronic acid with 80 milligram into the formulation. That's the one that's going to create this hyaluronic acid matrix. And into this matrix, we're going to integrate L-carnitine and vitamin C. Why we choose these specific ingredients to target this indication. So L-carnitine reduces the local fat accumulation, but also water retention and puffiness. What it's doing is the decomposition of the long chain of fatty acids with acetyl-CoA release, and normalize the metabolic processes, so will stabilize the cellular membranes and the skin salt-water balance. That will stimulate and fastens the reparative processes. It will mobilize the fat from deposit, and it has a drain effect, reducing the liquid congestion. The L-carnitine has a role in to break down the fatty acids. That makes this product very different from a lipolytic, that any other lipolytic that we can find on the market. Lipolytics generally, they break down the membrane of the cell, so they will destroy the cell, they will damage the cell, and that apoptosis will create an inflammation of the tissue, and this inflammation will create a reduction of the volume. L-carnitine transports the long-chain acyl groups from fatty acids into the mitochondrial matrix, so they can be broken down through a beta oxidation to acetyl-CoA, so we are going to obtain energy that can be used in the Krebs cycle. So we're going to transform this localized fat into energy. Then we also have the carnitine palmitoyl transferase, that is a mitochondrial enzyme in body tissues, and is associated with the internal mitochondrial membrane, and also this carnitine palmitoyl transferase mediates the long-chain fatty acid transfer into the mitochondria, joining with the L-carnitine. So we're going to have a help of these enzymes to metabolize this fat into energy. And when I'm telling that, I want to make an input that has to be very clear to you as injectors. That is not a treatment to reduce fat. It's to reduce weight, sorry. It's a treatment to remove localized fat. So the indication has to, we need to make a good analysis of understand vitamin C, as you know, play different biological functions in the skin, promote the collagen synthesis and the structural stabilization of the collagen fibers, so that will improve the quality of the tissue. It's a powerful antioxidant that will neutralize and remove oxidant molecules, but will also fight with the reactive oxygen species. We will reduce the synthesis of melanin in melanocytes, so we have an improvement of the skin coloration, but also will act on a specific cell, like will facilitate the proliferation and differentiation of keratinocytes and the release of lipids that surround the corneocytes from the stratum corneum of the epidermis. So that will facilitate renewal of the epidermis layers. It's not the only benefit, because vitamin C will also inhibit the hyaluronidase enzymes responsible for the breakdown of the hyaluronic acid in the in the skin, in the epidermis specifically. So we're going to have a longer lasting staying of the hyaluronic acid into the tissue that can help us to rejuvenate the skin, and has a very specific activity linked to the L-carnitine, because when we have the adequate concentration of vitamin C into the tissue, the adequate quantity, we can oxidize 30% more fat during a moderate exercise. Now we're having a demand from a lot of people that they are doing training, but they cannot remove some specific areas, the fat from some specific areas of the body. So with the injections of Cell Booster Shape, we can enhance and we can sculpt the body on specific areas that they need this little help with this amazing injectable booster that is Cell Booster Shape. Contraindications that we can have when we are administering these products: low allergy to any of the ingredients. There has not been anyone described yet. Patients presenting any skin alteration and skin disease, never inject on infected skin. And then we need to analyze if it's absolute contraindication or no. Patients under medication or diabetes, if they are descompensated, it's better not to treat them. But when they are compensated, it's not an absolute contraindication to treat these patients with Cell Booster Shape. Which one is the program? The program is an intensive course of 3 treatments with 2-3 weeks intervals, and we're going to do support course. One treatment, the treatment areas is face, neck, décolleté, the hands, part of the body. Of course, you can have this master book of protocols with all the technique, the injection angle and the injection depth. So you can, if you need some extra help, you can review the protocols. We are going to inject, in that case, patients that they have an excess of edema or puffiness in the face. We can inject with cannula, because this product can be meant to inject subdermally in the subcutaneous tissue. We drill a little bit, and I normally inject 1.5 milliliter per ME face. So these faces that they have a little bit of puffiness can be reduced, and we can also improve the quality of the skin with this treatment. I'm using a 25G cannula with a little entry point of 23 gauge, and you can see while I'm advancing and drilling a little bit to make the cannula glide more easily. Another area of treatment is under the chin. We generally need to treat not only under the chin, but also the trigonum submandibular. It's important that when we pinch the skin, we're going to need to have at least 1 centimeter of tissue to be this product effective, because otherwise the indication is not the correct one. Then we have an excess of skin, but not localized fat. So the proper protocol will be the 2 trigonum submandibulari. And you can see I'm pinching the skin, and for more or less every square centimeter, I'm injecting 0.1, 0.2 milliliter per point. So generally, with a vial of 3 milliliter, you have enough to treat all the submandibular area. You can see I'm pinching, and in that case, I'm using a very little needle, invisible needle, to avoid bruising and pain. I'm not afraid to inject close to the bone or to inject close to the skin, because this product will not destroy the membrane. It's much more friendly for the tissue, and slowly will degrade the fat and will reduce the edema. Generally, we have more needs on our patients, so you can combine in one session. For example, in this male, I'm treating with cell booster lift because it has a little bit of rosacea with papula technique intradermally. And then afterwards, I already marked submandibular, the area to be treated with cell booster shape. You can see here, I'm treating also the trigonum submandibulare and the bochin area. Very important. You can see that all the time I'm pinching the skin because I want to place the product on the subcutaneous fat, and more or less 0.1 milliliter per point in an area of 1 square centimeter. Other areas of the face that can be treated, for example, can be the malar fat pad, that we can have an edema or a fat accumulation. So again, the technique is to pinch properly and then inject the maximum of 0.1, 0.2 per point. So generally on this area, I will not inject more than 0.5 milliliter, because remember, we have hyaluronic acid. If we inject more, we are not going to have a better effect. Because the product needs to be distributed into the tissue, and if we inject more, the hyaluronic acid will trap water, so we're going to have maybe a little bit of edema. Don't worry, because the product is not cross-linked, it's only stabilized, will disappear, but we don't need to make the patient to suffer that. Lower cheeks, also we are having very nice results, and you see that technique all the time is the same. We are pinching and then we are injecting. Let's gonna see now the cellulite treatments with cell booster. So the average volume per session will be 3 milliliter per area, and we can inject subcutaneous retro-injection, or also we can do it with dermal papula to improve the quality of the skin that we have. Which one is the protocol? The same like on the face, 1 session bi-weekly, minimum 3 sessions average. Remember that cellulite is a chronic thing, so we can do once a month, 1 session to maintain. And we can combine it with other techniques, like for example, with energy-based device to have a synergetic action. And after that session, please avoid extreme temperatures, saunas, hammam, or direct exposure to UV lights. And after day after, makeup can use. Curiously, cellulitis is the only pathology which induces dermis changes, and we can see on different body mass indexes, we will target different kind of cellulitis. Here we can see these indentations that they are called like shark bites with a body mass index higher than 30. We can see that this cellulitis is a little bit more aggressive, with already indentations into the tissue, retractions. So we can see that is a dermal problem. Goodwill orthodox prevention like diet, sport, massage, and phytotherapy can help to prevent, but once cellulite is instaured, we need to find a treatment to solve it, because with only diet or exercise will not remove. So we can have different stages on the cellulitis. No cellulitis, we can do it once or twice a year for prevention. When the cellulite starts to be there, we can do as therapeutic, but when we already have the indentations, with cell booster will not disappear, because this is a retraction of tissue, because has been a fibrotic band created. So we need to put hyaluronidase, or we need to do surgically, we need to do a little cut, or with an energy-based device like could be Selfina, we need to cut it and then to try to release. So when we have a fibrotic cellulitis, we need to do the medical treatment in 2 phases. First of all, undo fibrosis, and second of all, undo the cellulitis, but also prevent that it's gonna appear again. Why this cellulitis is appearing? Well, actually, it's a blood vessel strangulation that create an inflammation of the tissue. So long-term maintained inflammation will stimulate the deep myofibroblast, and they are responsible of the dermal fibrosis. So that also will create an edema. So we are having higher blood vessel permeability. We're going to have more edema, so more cellulitis aspects. So it's like a realimentation procedure. So undoing this fibrosis will reduce the lymphedema, will release the blood circulation, and will also reduce the inflammation. These anchor points, they are created by connective tissue, and hyaluronidase or then dissection of that is one of the ways to treat that problem. We can see the corticoids, they are not recommended in cellulitis. Subcision can be done. Energy-based device I already commented, but hyaluronic acid, it's a marker for fibrosis processes, and hyaluronidases are a group of enzymes that regulate the hyaluronic acid metabolism and consequently remodel the extracellular matrix. So hyaluronidase has shown the possibility to block many fibrotic processes. Anyway, hyaluronidase is a protein with risk of allergy, so we need to do an allergy test before every injection, because we can do one session, no allergy, but we can develop an allergy after that session. So we need to repeat this allergy test. Why? Because we're going to use high doses, around 1,500 or 3,000 units per session. I recommend to dilute it in 10 milliliters of saline, and then inject 0.05 or 0.1 of this solution. So we're going to have between 6 and 15 units per point. You inject in these anchor points. You rest the patient during 30 minutes. We check if we have any allergy. This is how it will look like 20 minutes after the allergy test. And then we can start with the cell booster shape. I would recommend maximum hyaluronidase 2 sessions against the local risk of allergy, and then the cell booster shape. Cell booster shape is a sterile without any conservative. So once it's open, has to be used the whole vial. Can be mixed with lidocaine. There's no problem for patients that they are very sensitive. And I will do subcutaneous injections, deep linear retrograde, and we can also put with the tower technique, we can also put a little papula intradermal to improve the quality of the skin. Maximum 3 vials per leg per session. So we are talking about 9 milliliters per leg maximum. And remember that the maximum total will be around 30 milliliters per session. I will not recommend you to access this amount, because if you have any complication, you will not be able to control it. Side effects, we're going to have ecchymosis, definitely, because we are injecting subcutaneous, multiple injection. They will last for around 8 days. And we can use any sort of arnica cream or thrombocyte, whatever, but they will disappear. You just inform them that they will disappear, and no other side effect need to be expected. In case we have a very excess of fat, cell booster shape may be combined with phosphatidylcholine in the same session, but we need to target very good which one is the need of our patient. So if we have a patient with overweight, better treat first the overweight, and afterwards the cellulitis. Don't mix things. When we are talking about localized fat, for example, after pregnancy or after some weight win and loss of weight, we can simply inject cell booster in the localized fat tissue. We're going to do a marking 1.5 to 2 centimeters per square, and then again we pinch the skin and we inject subcutaneously 0.1, 0.2 maximum per point. Again, the same quantity, maximum quantity will be per treatment session. So maximum 30 milliliters in total, so 10 vials maximum per session. You can see it's very fast. Side effects you can have also the same, a little bit of bruising, but nothing else. If you have a patient, for example, that is very afraid of bruising, or they are taking anticoagulants, what we can do? Can we use a cannula? Definitely, because we can, with cannula, we can also place the product subcutaneously. In that case, I selected 25 G cannula, a little bit of drilling when we are advancing to be a little bit more friendly. As you can see, I'm tensing a little bit the skin for a better cannula gliding, and generally the same quantity of product, around 3 milliliter per session. I use my hand, it's a closed hand, like per vial, so you can have an idea how much vials you will need. If sometimes it's only below on the lower area of the belly, you need 1. If you need on both sides of the belly, you will need 2. If you need also the legs, then you plus up the quantity. In men, we have also high demand, most of them on trainers, because they really see a faster reduction of localized fat. They can see better definition. And we see that men and women, they have differences on the fat distribution. So in men can be on the belly or most demand in my practice, and already been a good training, but this area is like it's resisting to the fat to disappear. Then we can do a few injections, and generally with 3 sessions we have the result that the patient expect. It's not painful, it's a fast procedure, and we have very effective results. Here you can see before and after of this person that has been treated with cell booster shape. So let's go summarize a little bit. The indications is localized fat, cellulite, and water retention or edema. The program is 3 treatments bi-weekly, and then in chronic cases, like for example cellulitis, we can do 1 treatment a month to maintain the results. I would like to show you some of my results with other products from the Cell Booster range, like for example with Cell Booster Hair. Here we have a case of androgenic alopecia in a woman, so AGA, and we can see results after 6 sessions bi-weekly. You can see the hair with better structure, better tone, more body, and more thickness. He's an interesting case of seborrheic dermatitis treatment with also very good result. So we controlled the seborrheic dermatitis, but also look at the quality of the hair that is more pigmented, more thick. I presented a poster that was accepted by the INCA Scientific Committee in 2023. And here another interesting case, alopecia areata barbae, with very nice results. You can see here the first hairs that they appear, they are white because the hair follicle doesn't have capacity to pigment the hair, but later you can see here the hair pigmented. Here lateral view, and cell booster lift. Also interesting case for striae in the body. We can help to redensificate and to reduce these striae signs. And I wrote a poster together with Dr. Timur Taskesen from Switzerland about this interesting case that was also accepted as a poster on by the Scientific Committee on INCAS, the World Congress of this year. Cell Booster Glow, The last one on the range, also with amazing results for pigmentation. Here you can see before and after picture. After completed the protocol, we can see very nice result on the skin, better tone, better turgor, better structure, reduction on the poria, but also very strong reduction on pigmentation and equalizing of the skin tone. So to summarize, why I use Cell Booster? Well, first of all, because it's safe, and I think it's very important when we are using products for our patients. It's effective. I see the results, and they are representative results, so we can program, we can expect what we can deliver to our patients. There are virtually no pain. You can put a little bit of topic anesthetic, or you can mix the product with some anesthesia if the patient is very sensitive, but it's not a painful procedure. You really don't need recovery time. You can have a little bit bruising, but can be covered by makeup, or can be reduced faster with a little bit of arnica cream, for example. You can have synergic effect with other injectables that they are on the market. Like, for example, you can combine it on the same session with fillers, botulinum toxin, but also other therapies like energy-based devices, and is easily to combine with other treatments. So I know has been a little bit compressed. This is scientific pill. So let's see if you have any questions, and please do it on the question and answer area. So let's gonna see. And we have a very interesting question of Pia Vajalaka. Say, what about cannula technique to the double chin area? Yes, definitely. You can also use it because I will enter laterally, and then with a few passes, you can place the product there. Generally, I use a very little needle, like invisible needle or 33G needle, because how smaller is the needle, less painful is for our patient, but also less risk less risk of bruising, because the hole you're going to make is going to be smaller. So with a little bit compression, a few seconds of compressions, you are ready. But as I told you, for example, on the body, or if you need to do multiple injections and you have a patient that is bleeding a little bit, definitely you can use a cannula. And then Juliana is asking, can you mix lift and shape in one syringe for the chin, for example? Well, from my point of view, it doesn't have a lot of sense, because the target for lift and the target for shape, they are completely different. Shape is more to reduce localized fat and edema, and lift is to improve the skin quality and to have a lifting effect. But we can combine them in one session. For example, you could inject shape subcutaneously and lift on top intradermally. So that will be a more effective approach for your patient, and a better result at the end, because lift, even though we can inject it subcutaneously, if we use a cannula, we will use it more on the superficial layer, on the hypodermis. We're going to try to inject. Then a very interesting question, Pecuraroana, if it's injecting in a blue vessel, can provoke occlusion? Well, actually not, because this product is not cross-linked, even though it's stabilized and has a higher resistance to hyaluronidase. The thickness of this product is not big enough to do an occlusion on a base. So don't worry about that. Of course, these products are not made to be injected into a vessel, so they're meant to inject it into the tissue. But if this happens, if some product click into a vessel, don't worry, because you cannot create an occlusion. And till the moment, not any occlusion has been notified to us. And then Elena Pitara, how many vials maximum you can use in one session? So generally, we put a maximum of 10 vials. Can look like a lot, but if you're doing legs, doing belly, and doing face, 30 milliliters will be the total amount of hyaluronic acid we will recommend in one session, including if you do fillers on the face, if you do cell booster lift, cell booster glow, if everything you do, the maximum will be that. Why? Well, imagine that you have a problem or you have an infection on a specific area, then this infection could be difficult to control. And remember that hyaluronic acid is also trapping water, so you could have a huge swelling in case of anything. So for many years, this total amount is defined. Then Sylvia, how to treat upper eyelid with lift? Also, what you thought on the eye bags with shape? Okay, eye bags with shape. Definitely we can treat it, but little quantity of product if we have the edema infrapalpebral. Generally, we treat the malar area. So remember, we pinch the skin and subcutaneously we inject 0.1, 0.2 maximum. I would say maximum 0.5 perioral area. And then for upper eyelid with lift, always lateral from the pupilla, and then I will do 1 or 2 points on this area, but not in the palpebra. Also under the eyebrow on that area. Peculiarana, what is the maximal quantity for double chin for one session? Okay, so the maximum I will recommend you is 0.1 or 0.2 per square centimeter. Okay, so if you have a double chin that's starting on one ear and finish on the other one, you will need much more product than if you have a little double chin like mine. Yes, I need a little bit of shape. So probably here I will need 9 or 10 injections. So 0.2, 0.1, this would be 2 milliliters would be enough for me. A person who needs a little bit more, maybe 3, maybe 6 milliliters, you need to adapt to the patient. But you need to count that per area. Can we use CELLBOOSTER shape in eyeliner? I don't, I'm not that familiar with this eyeliner thing, but if you mean on the eyelid, I will not put it on the eyelid. Now, if you mean that we have on the brow or somewhere, I don't think it's the indication actually. So remember, the indication is excess of fat and excess of edema. If you want to combine with dermapen, how long elapses between treatments? Depending where you are placing the CELLBOOSTER shape. If you are placing the CELLBOOSTER shape subcutaneously, you can use dermapen on the same session without any problem. Okay. It's possible to mix glow cocktail with botulinum toxin for intradermal driving. Yes, to improve the quality of skin. Yeah, you can use mesobotox, and definitely you can mix it with CELLBOOSTER Glow. How many vials you recommend for belly fat? So depending on the area, but I will not go normally for one close hand. I will use 1 vial. So more or less, this will be 3 milliliters of injection. So depending, you can use 4 per vial, 5 vials maximum, but be clear that is not to reduce weight, is to reduce localized fat, and make that clear to your patients. Okay. So thank you very much for your questions. It was very, very interesting. And if you have more questions, please feel free to send it by email to your distributor, and we will try to answer them later. And you can follow us. You can follow Swisscell on Instagram, on Facebook, on LinkedIn, on YouTube, where you can find this webinar and also a lot of other videos. swisscell.pro. And if you want to follow me, you can also do it on the Mayo Clinics International. Thank you very much for your time. I hope to see you soon in another webinar or in a congress, because this year we will be presenting results of Cell Booster in Monaco, and I will be very happy to attend to that session. Have a nice evening, and see you next time. Bye-bye.